Hello, this is Dr. HBsAg, one of the doctor of general medicine at the clinic. Before the proceeding our discussion, am I talking to the Mr. Jason, 35 years old?
Yes, doctor.
Okay, nice to meet you, sir.
Nice to meet you too.
Okay. So before the proceeding our discussion, I'd like to know how much do you know about the condition? Could you please tell me?
Uh, for the past few days, I was feeling tired, and I went to my GP for a routine checkup. But he said that some of my blood tests have been going wrong. So that's why
Okay.
he has referred to you for this condition. But other than that, I'm not known of any other conditions about me. But the main thing is I have been feeling a bit tired lately.
Okay, I got it. Allow me to ask you more the question that will be
Sure.
helpful for us. Can I ask you more the question regarding this condition?
Yeah, sure.
Okay. You went to the GP because of the tiredness, and GP
Yes.
did some of the blood work, and this the little bit the high, and they did also some of the viral test, and it came out hepatitis B the positive. Okay.
Yes.
Are you following me? This is okay.
Yeah, yeah.
I'd like to ask some more the question. Do you have ever the feel the yellowish color in your the skin or the eye or your water work, the yellowish the color? Have you ever experienced this is the kind of the situation?
Yes, as far as I remember, about a year or more ago, there was an episode of yellowish discoloration of my eyes, and also, yes, you're right, my waterwork was also dark. But
Okay,
this settled over itself, and it lasted just for a few weeks.
okay. Did you go to the doctor for this the reason that the why you developed the jaundice?
No, I didn't go to the doctor as it settled by itself.
Okay, so I would like to ask some more personal the question, and if you get offended by that, just let me know. I will stop from at any
Yeah, sure.
point. Okay, so do you have are you what about your the relations status?
Uh, right now, I have a casual sexual partner, but about 18 months ago, I have been separated from my long-term partner. After that, I had some unprotected vaginal intercourse with two women, but both of them I don't know much about them. But
Okay, okay, I got it. So the right now you're alone, or do you have any regular partner?
yes, I have one regular partner, but she doesn't know anything about my condition.
Okay, got it. So, sir, hepatitis B is some kind of the infection that's the infected with the liver. So that's why from the where this the source of the infection, I need to sort out. That's why I'm asking this the kind of the question. So if you feel any kind of the bad feeling from my side, but if I ask some anything the bad, you can just stop me as early as possible if you want. Okay.
Doctor, you can proceed.
Okay, so I'd like to ask some more of the question. As you are the already told me, if have you had a regular the partner, and do you know the her health status, any kind of the illness or any kind of the jaundice the she developed during these the
No,
days or in the past day?
my my recent partner, as far as I know, she doesn't have any medical condition or hasn't checked recently. But my most recent sexual partner, I don't know her actually a lot, but I think I have received this disease from her. I doubt that I may have got this disease from her.
Okay, I got it. So your recent the relationship, I just slip it from my mind. Your recent relationship, how long from the how long your recent relationship?
It's about 3 months only.
Okay, the 3 months ago only. And so the before that, are you the alone or any physical intimacy with any casual contact with anyone?
Yes, I had a casual contact with two women.
Okay, do you know them?
No, I don't know about them really, and I don't know that whether they have got some physical condition or whether I don't know actually about them.
Okay, okay, got it. No problem about that. So I'd like to ask some of the more of the question. Do you have any the surgery in the past?
No,
Okay, so do you have any history of the blood transfusion or any accident? Did you ever met?
Mm, no, doctor.
And any tattooing in any part of the body,
No, none of that.
piercing, ear, or any part of body?
No.
Okay, I got it. So what about, I'd like to ask about your the family history. Are you the parents all are healthy?
Yes, they doesn't have any disease that I know of.
Okay. And they don't have, they ever appear any sort of liver disease or any sort of the jaundice?
No, not that I know of.
And do you have a sibling?
Yes, I have two siblings, but they are completely in good health.
Okay, they are healthy. They never ever experience the liver disease.
No.
Okay, they got it. So, do you take any medicine?
No, currently I'm taking only some vitamins, but no, only some over-the-counter medicines, but no regular medications.
Okay, so what's the medicine name?
Only some vitamins prescribed by my GP.
Okay, okay, got it. So, any the herbal medicine or any Chinese herbal medicine?
No, doctor.
Okay, so I'd like to ask more the personal question. If you feel that offended, you can just stop me. I really ask to all of my the patient to sort it out from the source of the hepatitis B infection. If you allow me, I can ask.
Sure, doctor, you can proceed.
Okay, so do you have ever take any injectable illicit drugs?
No, doctor.
Any social the partying the drugs?
Sorry?
Uh, Partying drugs, recreational drugs.
No, no, doctor.
Okay, okay. Do you smoke?
No, I'm a non-smoker.
Okay. Are you the taking alcohol?
Yes, sometimes I take, it's only about 4 to 5 pints per week
Okay, so this is under the social limit.
under the social limit line.
Okay, so I'd like to ask some more of the question, and is it related with your the condition, as the hepatitis B can the spread through physical intimacy or the sometimes the sharing of the blood product, like if you the take a transfuse of the blood, or sometimes the sharing of injectable medicine like drugs, illicit drugs. That's it may be the spread like that way. So as the one of the cause is it got by the physical intimacy. So it
Yes.
can be the other the sexual transmitted the disease can be the present with the hepatitis B. Can you ask some more the question regarding this condition?
Yeah, sure, doctor, you can ask me.
So do you have ever have the painful the water work? Any the problem with the water work?
No, doctor.
Okay. So do you have any lower tummy pain?
Uh, no, not recently.
Okay. So do you have any the private part, any sore or any abnormality? Any lump and
No,
bump?
no,
Okay.
doctor.
Any sore around mouth?
No, no,
And any joint pain? Non-specific joint
no.
pain. Okay. So anytime the redness of your eye or something the dryness, any problem in the eye? Ever feel that?
No. 2 years back, I just had one episode of viral conjunctivitis, but that's all. Other than that, I didn't have any eye problems since now.
Okay, I got it. So, do you have ever have? I really sorry to ask that, but I can sorry these things out if I ask this is the question. If you answer, so do you have ever any sort of a sexual transmitted disease?
No, except this recent hepatitis B positivity, I didn't have any kind of or any sort of diagnosed sexually transmitted infections.
Okay, so sorry, I didn't get that. So you don't have any this other kind of the history like that.
No, I just felt a bit tired for 3 months, but other than
Okay,
that, I had only a
okay,
history of jaundice or anything.
okay. Uh, this the situation is I really feel for you, but yeah, the question is getting the more the deeper. So can I ask you the more the about your the personal details?
Like,
Okay, so do you have the ever any physical intimacy with the same gender with another man?
no,
Okay, so your physical intimacy is what is the type of the physical intimacy uh, you have ever experienced? Like apart of vaginal, there is any oral or anal physical intimacy? Did you ever
no,
get?
doctor.
Okay, I got it. So I would like to examine you if you permit me.
Yeah, sure. You can proceed.
Okay, so I like to see this the Euler's discoloration like the jaundice or the patient have any lymph adenopathy. Also the with the sign of the CLD, the like the patient that have the spider nevi or the patient is the gynecomastia and the parotid enlargement. I should also like to the check then with the palmar erythema, leukonychia, clavin, Dupuytren contracture, along with that any hepatosplenomegaly or not, and ascites. And as the patient is have the multiple of the sex of the partner, so I need to check also the private the area. There is any hidden the ulcer the sore is present, is it not? And also they see any the syringe the mark any sharing of the needle as the patient and also patient doesn't have any the history of injectable drugs. So still I need to check any injectable area present or not. So sir, the what are the concern right now? Can I know?
Actually, I'm worried that how did I get this condition, and is my sexual encounters are responsible for this, and uh, am I in a risk of developing cirrhosis in future, as I have read from the internet about cirrhosis, and or can I get cancer from it? And how can I get rid of this condition? And should I discuss it with any of my friend or not?
I didn't get the last question.
Actually, my partner or yes, my sexual partner. Can I? Should I share this thing with her or not?
Okay, I got your point. Let me answer for you. The first of all, the sir, as you develop the jaundice, the 1 year at the back. So well, we assuming that you get it from here. This is the infection. So the before the 1 year, if you have the already told me you have the 2 to 3 the partner 1 year at the back. So I think this the infection that came with the from that at the time. Okay. So next the question is how can you get it off? So that's the why we'll do the some of the more the blood of the work to see the how the blood of the function, your liver the function in your the blood. Along with that, there is a some of the fibroscan and ultrasound. We will do that. If you see that there is the some the viral the load in your the blood is high, then we'll the start is some of the medication, which is the repeated for hepatitis B, and all the management is supposed to be the done at the under the liver disease of the doctor. So our main the motive is that this is the virus that can't be the low as maximum as possible. We'll keep it too low as is possible. And already there is some of the complication that can happen from hepatitis B. Yes, it can be the happen in the cirrhosis. It can also the happen the cancer, but this is very the late in the condition. If we the suppressed the if we the treat you the properly at very the early the stage, initial stage, and we can the minimize this the complication in the future. Okay. So yes, you have some of the chance to being the cirrhotic or the in the liver the cancer, but our the motive is to the follow up you regularly 6 monthly. If you see any sort of these are the things in very the early stage, if we detect that will the start the maximum treatment and appropriate treatment as early as possible. And your the last of the question is about your the partner. Yes, you have to tell your the partner about this condition. If she doesn't vaccinate it, she need to do the screening, the test, and as early as possible. If the screening test is negative, as early as positive, she the must be to get the vaccinated. And don't need to worry about that. We'll inform our the hospital and the notification protection the advice the team. They will the screen out and the stressing all the is a partner you have the got the physical intimacy. So they will be the under our the screening and the test. If so this is the hepatitis B infection not going to the spread from you or from your the partner to the another the people. This is our the main the motive. Okay, so I like to ask some of the more the question. And your family the member whom do you are living?
I'm living alone right now.
Living alone. Okay, so still if you're the physical contact, they will all be the under in screening the process. And you're the parents, you're the sibling, and they must be also the under the screening the test. And though this is not the spreading the from the them, still they need to do the some the test. If they are not the vaccinated, they as soon as possible they get the vaccinated after the screening test is a negative. And I like to give you the some of the more the advice about your the lifestyle modification, if you allow me.
Yes, please continue.
So before that, and as you're the hepatitis B the positive, and so that's why, and it's better to the use your the personal belongings by yourself, but not to be the share to the other, like your razor, like your the toothbrush. They're supposed to be used only by you, and not to just to avoid to avoid to donate the blood at this at the moment, not at this moment. If not really possible the by you to donate any of the blood. And this is all about. Do you have any concern?
How long should I have to take the antiviral drugs that you are
Okay, and
suggesting?
I will refer you our liver the disease the doctor, and also our infectious is the doctor. And after all the blood of the work and fibroscan and the ultrasound, and they will decide that what will be the treatment the plan. So sometimes the patient will need only the 6 months to clear it the hepatitis B the infection, and sometimes a very few percentage they are not going to uh, be able to clear their of the virus from the blood. So this is our the future the plan. Let's see. It is after the blood all the blood work and skinning the test is coming. then we can decide what will be the proper treatment. Okay.
I had another query.
Sorry.
I had another query.
Yes, please, sure.
After treatment, will all of my blood parameters that are positive right now will eventually become negative?
Actually, few patients, I already told you, only the few patients, they are failed to clear this the virus from their blood. But majority of the patient after the 6 month 6 month of therapy and after the treatment, maximum patient like 85 of the patient they can able to free the virus from their the body. Is yes, there is a chance to negative all your the blood work is a negative after the 6 months. But right now we are can't say anything. It needs some the time that how your the treatment is going on. It depend on that.
Okay, I got it.
Okay. Can I ask you some more of the question?
Yes, sure.
Yes, as hepatitis B is can be the transmitted. Already, I told that they've got physical intimacy, so it can be the other the sexual transmitted disease can be the present with the hepatitis B. If you allow me, I can refer you our some genitourinary the clinic, and they will do the some more the test for to get to know that there's another sexual transmitted disease at the present or not, like hepatitis C or hepatitis HIV. Is it okay for you?
Yes, it's definitely okay.
Okay. So that's all of the from me. Do you have any particular any other concern you can ask? Or otherwise, this is I would like to the wrap up our the conversation today.
Yes, you can wrap up. There's no other queries from my side.
Okay. Okay, thank you so much. Have a good day.
Thanks a lot.
ওকে 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 আপনি তো বেশ ভালো বলেন, এটা মানে বলার অপেক্ষা রাখে না। আর
আচ্ছা, কি
আপনিও
কি
ভালো
মিস
ছিল।
গেছে? হ্যাঁ, হ্যাঁ,
হ্যাঁ,
কি ভুল বা মিস?
তো সবই তো টাচ করছেন দেখছি আমি। হুম, আপনার প্রেজেন্টেশন খুব ভালো, এটা একটা সুন্দর। হুম,
হ্যাঁ, একটা জিনিস
যাই হোক,
জানার ছিল, সেটা হচ্ছে যে মানে
হ্যাঁ
কোর অ্যান্টিবডিটা তো পজিটিভ থেকে যাবে, তাই না? তার লাইফ লং তো কোর
হ্যাঁ,
অ্যান্টিবডি
এটা লাইফ
থেকেই
লং
যেতে
পজিটিভ
থাকবে।
থাকবে।
হ্যাঁ, হ্যাঁ।
হ্যাঁ, সেটা কি পেশেন্টকে বলে দেওয়ার দরকার আছে যে হ্যাঁ এটা আপনার সারা জীবন পজিটিভ থাকবে এবং সেটাতে আপনার কোনো সমস্যা হবে না? ধরেন তার তো এটা কোয়েরি মনে হয় থাকতে পারে যে এটা
ওর
ট্রিটমেন্টের
অ্যান্টিবডি
পরে তো কোর অ্যান্টিবডিটা ভালো হবে না।
না, এটা ভালো হবে না, কিন্তু এটা কি বলার খুব দরকার আছে মনে হয় না।
মনে হয় না, মানে আমরা হচ্ছে কি কনভারসেশনটা as much as হচ্ছে সিম্পল রাখার চেষ্টা করব, মানে
হ্যাঁ,
অল্প কথায় এক দুই সেন্টেন্সে শেষ করবো আর কি, এরকম।
যদি এটা কোর
ওরে তো হ্যাঁ,
থাকে
ওরে
বলে।
তো কোর অ্যান্টিবডি বোঝাইতে হচ্ছে আমার অনেক সময় লাগবে, সে তো বলবো আমার
হ্যাঁ,
কেন পজিটিভ থাকবে, তাহলে আপনি আমার কি মেডিসিন দিচ্ছেন?
সেটাই
হ্যাঁ,
পেঁচাতে থাকবে আসলে। হ্যাঁ, মানে আসলে একটা সিস্টেম ওরিয়েন্টেড করে ওই মানে আগাইতে যেতে হবে আর কি, সিম্পল। এত ডিপে যাইতে দেওয়া যাবে না বা নিজেও যাওয়া যাবে না। তাহলে দেখা যাবে দুই দিক থেকে যে কোনো একটা প্যাসে পড়ে যেতে হবে আর কি। আচ্ছা, এমনি সব ইস্যুই আসছে, সব টাচ করছে। হম, ভালো ছিল এটা আর কি।
আচ্ছা
আচ্ছা।
ভাইয়া, ওই যে ফিজিক্যাল ইন্টিমেসি নিয়ে না আরেকটু কোশ্চেন করতে হবে, যে
হ্যাঁ।
তোমার যে হচ্ছে আগের যে পার্টনার গুলা যে তুমি যে হচ্ছে ক্যাজুয়াল কন্টাক্টে আসছিলা,
হুম
প্রোটেক্টেড ছিলা কিনা, ফুললি প্রোটেক্টেড ছিলা কিনা ডিউরিং দিস এট দ্য টাইম, এটাও একটা জিজ্ঞেস করতে হবে, ওটা তো মিস করছি।
হুম, আচ্ছা আচ্ছা, ওকে। আর কি কি থাকতে পারে রিলেটেড এটা? হুম, এই এই এইগুলোতে আসলে এইগুলো মানে ইনফেকশনাস ডিজিজ গুলাতে মেইনলি সেক্সুয়াল হিস্ট্রিটা ওরা ভালো করে জানতে যাবে আর কি,
হুম, হুম।
কনসার্ন বেশি দিবে এখানে। আচ্ছা, ওকে ওকে। আর কেউ আছে কিনা?
আচ্ছা, এটা কি জিজ্ঞেস করার খুব দরকার আছে? এখানে যে বললো যে এবার এক্সচেঞ্জ মানি ইন রিটার্ন ফর সেক্স ইউকে অর অ্যাব্রড, এটার কেন জিজ্ঞেস করছে এটা বুঝলাম না।
এটা না
এখানে
আমি
কেন
বুঝি না,
বললো এটা
এটা
বুঝতেছি
না
না।
বুঝি না, এর জন্য আমি জিজ্ঞেস হচ্ছে করি নাই আর কি। কিন্তু এটা
হুম।
মনে হয় একটা ইউকের ইয়াতে গুলাতে মনে হয় আক্স করতে হয় বলে।
কোনটা কোনটা জানি?
এটা আদার ইস্যুস ইনক্লুডিং ফ্যামিলি হিস্ট্রি, তার উপরে কি কথাটা আছে?
Ask about the
যে
medications.
এবার এক্সচেঞ্জ মানি ইন রিটার্ন, তার উপরে যেটা।
আচ্ছা, ever exchange money in return from sex. এটা এটা জিজ্ঞেস করে কি করব?
সেটাই।
মানে এটা না আমি খুব একটা ভালো বুঝি নাই কথাটা আর কি।
মানে সে হচ্ছে অন্য কারো কাছ থেকে টাকা নিচ্ছে কিনা, বিদেশি কারো কাছ থেকে টাকা টাকা নিচ্ছে কিনা এগুলা। এবার exchange money in return from sex. Sex মানে সেক্সুয়াল যে বিজনেস করে ওরকম কিছু। এরকম হতে পারে। আচ্ছা, তাহলে আমরা নেক্সট এর জন্য একটা টপিক রেখেছি। নেক্সট এ হচ্ছে আমরা এদিকে হচ্ছে ক্রোনস ডিজিজ নিয়ে করবো, হ্যাঁ, ইনফ্লামেটরি বাউল ডিজিজ। আচ্ছা, ওকে।